We turn now to Laura Windsor, who's reporting from a prominent children's hospital.
Thanks, Roger. I spoke with Amy Waunch, a clinical nurse educator at Children's Hospital of Orange County's Emergency Department. She tells us about methods to help alleviate pain and discomfort for children, which makes their visit to the ER less painful.
We know that anxiety heightens the pain experience, so in the CHOC Emergency Department, we are very knowledgeable about the different developmental stages of children, and we know how to approach children and their families to decrease the anxiety that comes with an emergency department visit. We understand that the family is a very important part of a child's life. Therefore, we do not separate the child from the family. We actually involve the family in the child's care. And one example would be the need to start an IV or obtain blood from a child. We actually encourage the family or caregiver to participate by holding the child in a position of comfort. This decreases their anxiety and helps the nurse get the job done quicker. We have found in the emergency department that distraction is a wonderful tool for decreasing anxiety and pain in children. And we have a lot of techniques that we can use for distraction. We use iPads, and on the iPads, children can play games, they can watch videos, they can even draw. We also use things as simple as singing during procedures to help decrease the anxiety and pain with children. Some other painful procedures that sometimes take place in the emergency department would be lumbar puncture, maybe having to do a laceration repair with stitches. And the nurses have protocols in place that allow them to rapidly administer pain medicines to decrease the pain associated with such procedures. We use topical anesthetics. We also use something called J-tip, which allows us to insert lidocaine, which is an anesthetic, into the skin without any needles. That way the skin is completely numb by the time we need to perform the procedure. For infants, we use something as simple as sucrose water, and that combined with sucking actually helps release endorphins, which can block pain receptors in the young infants. We know now that children as young as 1 day of age experience pain. And if we don't address it, it will have negative consequences for them in the future. 14 years ago, we didn't know that. We relied solely on the parent's perception of the child's pain. And now we have tools to assess the child's pain, and we have even more tools to treat the child's pain. One of the most important things any parent or caregiver can do is to remain calm. Children base their response to any situation on what their parents are doing. If mom, grandma, dad, brother, sister is overreacting, the child thinks that's the appropriate response. In our emergency department, the nurses have been trained to manage those types of parents. We give them specific instructions. We help keep the parents and the family calm so that we can better serve their child.
It's comforting to know that an ER visit doesn't have to be stressful, scary, or even painful for your child, especially when the experienced staff provides exceptional care. For the American Health Journal, I'm Laura Windsor.